Stephen, who we heard earlier, has used techniques such as these to help him in his fight against depression.
They've helped me considerably, because, like giving up smoking, where you can use chewing gum and in patches for a while, at some stage you've got to face things yourself, and that's the critical point, whether you will actually give up smoking. I wanted help. Cognitive therapy brought me into contact with somebody who was highly qualified. I'd probably seen dozens of people exactly like me, who taught me to look at myself and for me to manage the changes that I wanted, but for it to come from me by teasing out various things in my past and the way I looked at things and the way I wanted to look at things. And by doing that, and by being positive about that, I began to realise, it took me, after the first couple of sessions, I began to realise, it was about the fourth session, that I can really get something out of this. If I keep coming each week and I'm really positive about it, it's going to work.
Stephen describes how, using CT, he came to grips with the seemingly straightforward task of preparing his family's dinner, something which previously had caused him to go into a depression.
Knowing that they'd be arriving in about 4:30 and they'd all be saying, "We're starving," and knowing that from the past experience of doing the dinners at home, that I would never have the pans on at the right time and everything just come together sometime. Therefore, I'd be upset. Once I started saying they're starving, where's this and where's that, that would get me upset, and therefore I could get quite depressed about that. I wouldn't say anything, I'd just get on and do things, but during the evening, the inevitable thing would be that I'd go upstairs and I'd just stay away from them, and I'd be quite miserable. That would come up each week, 3 or 4 times a week, because we're making the dinners all the time. My rational response, which is like the next column on the sheets I used to the cognitive therapist, was to get a rational way of looking at that situation, like making the dinners. The rational response was, it'll be a good dinner anyway. They'll be fed at the end of it, and come 6 o'clock, when everybody's fed, everybody will be happy and smooth. So why worry? So the strategy was to have a smiling face when they came in, to ask them how they'd got on during the day, and to look upon that as more important as whether than if they were going to come in saying, "Where's this and where's that?"
It's important to emphasise that what works for some people doesn't work for others. Peter, for example, finds drug therapy very helpful for him, but talking and counselling therapies less so. In his view, people with depression should find a doctor sympathetic to their particular symptoms. Vicky prefers not to take drugs at all unless she really needs them, and she relies on her own determination to defeat her problems.
I can carry on with everyday life, and most people don't know I'm depressed when I am. I've got a good coping mechanism. I'm a fighter, and after about 3 weeks of being really bad, I decided that I wasn't going to let it beat me anymore. I was going to fight this thing. I had abilities. You just take each day as it comes. If you have a bad day, then you just chalk it to experience and you get on with the next one. It's best to get yourself into routine, even if you're not working or you feel you've got nothing to get up for. You still do something. I mean, even if it's just a walk down to the local shops. You make an effort with people. You don't have to tell them, "Oh, I'm suicidal," if you don't want to. Just try and talk to people. It's really hard. It can be very draining. It can make you very tired. But each little step, just look at simple things like birds singing, flowers growing, just the simple things that you take for granted. But they're very beautiful, and it's all life, and life is precious. You just build on your experiences, And okay, not every day is good. I mean, not even people that aren't suffering from depression have bad days. That's just part of life, and life can be hard. But it can also be very beautiful. There's a lot to live for. And I just take each day as it comes and try and make the most of everything.
Eric, meanwhile, has found that being active and contacting other depressives has been his best route to a more normal life.
Yes, I think I have coped. I think ultimately by getting more active with things and not giving up, I suppose that's the main thing, and also accepting the fact that depression, which is something you never want to go through again, it has its positive side, because you learn more. You sort of you see things. You see that there's a lot more to life than perhaps the ordinary person who's never gone through this hellish thing. You're more understanding of other people, for one thing, more understanding of other people's problems, and also the fact that you've come through it, that you've actually come through it, is also a morale booster. It's like a lot of other problems in life. If you look at it, you probably find you have gained something as bad as it is.
There are other things you can do to help ease your depression. Dr. Tiley recommends improving your general fitness by exercising for 20 minutes 3 times a week. This stimulates the body's natural endorphins, chemicals in the body which lead to feelings of pleasure and uplifted mood. Regular physical exercise, he says, has been shown to help people's mood. A sensible diet is also important, and you should be careful to avoid excess carbohydrate and fat. And what about the families of depression sufferers? Family and friends often want to know what they can do to help. Being a good listener, and a patient listener, if you've heard it all before, is very important. Professor Robert Priest offers this advice.
The best thing you can do, really, is to lend them a sympathetic ear. And it isn't easy, because the depressed person, when they're feeling very sad, often feels that nothing will help them, and they're very pessimistic, and may imply that you're wasting your time. So that it's not always easy, but it is important for relatives to lend a sympathetic ear without necessarily feeling obliged to offer instant solutions to the problem, instant remedies for the depression, but just to listen and just to try to understand how the person is feeling. Because it is quite a relief for somebody who's depressed, if they feel they can get it over to somebody else exactly how they are feeling, exactly how they do feel sad and hopeless, then that is a relief in itself. A lot of people that are depressed feel that nobody really does understand them, that nobody really believes them even. People that are depressed feel that other people don't believe them when they say how sad and hopeless they are, and that they could easily snap themselves out of it if only they tried. And so if you're a relative, then it is important to listen to the person. It's important to try and convey to the person that you accept what they say, that you accept that their feelings are valid statements of how they really feel, and obviously to sympathise, but without implying that there's an easy remedy for it.
Pat Freya is a member of FDA, the Fellowship of Depressives Anonymous, a self-help group for depression sufferers which was founded in the early 1970s. Family and friends, she says, should not feel guilt.
I think many families of depressives feel that they ought to be able to do something. And very often you can't actually do anything. You can only be there for your relative or loved one. You might be able to direct them towards getting help, towards the doctor perhaps in the first place, or to a group, or to a counselling service. But you can't do it for them. And if they will not accept your help, it's no use feeling guilty, because that is not your responsibility. It's sad, but true. And one thing you can do is look after yourself and not get yourself pulled down, not think you have to hang about and be there always for them, to be quite firm about looking after yourself, or you finish up with 2 depressives in the family instead of 1.
FDA is one of a number of support groups and organisations which will lend a sympathetic ear and put you in touch with other sufferers. Pat Freyer believes groups like hers have an important role to play in helping depressed people.
When you're brave enough to make contact with FDA and you get some sort of a reply back, then you realise you're not alone. And I think that is quite a way to start beginning to feel better about yourself. And a lot of recovering from depression is starting to feel better about yourself. We can then offer them different things. Obviously, some people get the newsletter and they read about people like themselves. They might make the effort. We sometimes have people who write something, and having succeeded in writing something, that is an achievement. And again, depressives need to be achievers because they feel they're no good to anybody. And to find out that your bad experiences can help somebody else is really marvellous. I think this comes over more within the groups. We can put people in touch with groups if there is one, or we can help people to start a group in their area. And if you get to a group and you go there feeling absolutely awful, and then somebody says something and you can respond to it, and they say, "Thank you for saying that. You know, that's helped me to see things in a different light." You go away from that meeting thinking, "Oh gosh, I can help people. I'm not at a loss." And even if you can't, you sit there and you listen to other people's experiences and think, well, I'm not the only one. Other people feel like that. I'm not going crazy. That, I think, is the start. The identification with other people and the feeling that you can be of use to other people. I think those are 2 very important strands. FDA stands for people looking after themselves and finding out for themselves what suits them as individuals. Nobody can tell you what suits you. And what we try and offer is a lot of different options and permission to follow different paths to find out what is the right path for yourself as an individual. That is what I see as self-help, sort of 2-edged. One being helping and being helped by and helping other people, and the other is looking after yourself.
Details about how to contact FDA and other support organisations, as well as information about useful books and leaflets, can be found in the literature accompanying this cassette programme. There's also a contact number for the British Association for Counselling, which can put you in contact with individual counsellors in your area. So the message is, however black your depression, there are effective treatments available, and there are things that you can do to help yourself. Take on board some of the techniques we've described on the tape and stick with them. Don't expect instant success, and don't give up. If you have a setback, try and think positively again and talk your problems over with a fellow sufferer, a relative or a friend. Above all, don't give up. Do get help. Good luck.
First of all, people just desperately want it to go away, and you probably feel some days that it's a real burden just to actually feel like this. And one of the important things is always to let people know how you're feeling, particularly if it feels really black. You'd be surprised sometimes how much they can do to help, even if it's only to distract you for a brief while from the way you're thinking. Or if it really feels black and you're really not sure what to do, then it's always worth having a chat with the professionals who are perhaps involved in trying to help you about that, to ensure that the treatment that you're receiving is the right one, and that together you're working as a team and all trying to pull in the same direction. I think the other thing to say is that getting better from depression will also have a few days where you have a few setbacks. It's a bit like climbing a mountain. It's not a nice smooth rise up from feeling down to the top. You'll go up and down a few peaks first, some of the smaller ones, but hopefully even the dips won't go back to square one, and you'll gradually find that the overall pattern is just gradually getting better and better. Although, as I say, don't be put off by the occasional setback. These things do happen. but it doesn't mean you're going to go back to where you started from.
It does get better. It's not overnight. I know it's not overnight. I know. Try not to take any notice of someone who says snap out of it, or there's nothing wrong with you, or just go away and take these pills and everything will be all right. If you've got a problem, make sure you tell people. You'll find there are people out there that will listen. There are people that understand. If you're not strong enough, get somebody who's close to you who will fight for you, because there is help out there. You've not got to give up.
First of all, you've got to get medical help. It's difficult to do it alone because you're so low. You haven't got the initiative to do anything at all, really. So you've got to have medical help. You've got to make that initial step to do something. As how unimportant it seems, and how little an effort it is. And to do things all the time, to do things, even if it's just to go out and go in a cafe and have a cup of coffee or something. If you feel nothing like doing that, all you want to do is to sleep, is to make this effort. And then the next thing, of course, is to try and find a group of like-minded people, a self-help group if possible, which was a big help to me, I know.